Great, perfect. So welcome everyone once again to this Zoom community chats hosted by Montefiore Nyack Hospital. I'm your host, Sandra Arevalo. I'm the Director of Community and Patient Education here at Montefiore Nyack Hospital. And today, as every Thursday, we have great panelists with us. They are Lorraine King and Kara Stanley. And welcome and thank you so much for making time to join us and answer the questions of our community. Our topic of today is home care and other resources, other community resources, I should say. So please, I invite everybody to start writing your questions in the Q&A and chat boxes. You don't need to talk. You don't need to turn your cameras on if you don't like. We want you to sit comfortably for the next hour and just get all your questions answered. So let's start, girls. Lorraine, maybe we can start with you. And you could tell us, please, like who you are, what you do, and how you got into that what you do.
Okay, thank you. And thank you very much for this opportunity to talk about Montefiore Nyack Home Care Department. By background, I'm a physical therapist. I've been a physical therapist for 41 years. I've worked in the inpatient and outpatient settings, and then finally found my ultimate calling in home care in 1997. I became the manager of a large rehab department in another home care agency in the Hudson Valley. I went on to positions in quality, operations, performance improvement, and information technology. And that led to becoming the manager of operations in Montefiore Nyack Home Care in 2015. Recently, just this past June, I accepted the position of administrator for Montefiore Nyack Home Care Agency. I live in Ulster County with my husband, and we made that choice to be near our children and our grandchildren.
That is great. Thank you so much for the introduction. And now you said home care already a couple of times. So what is home care exactly?
Home care is a department of Montefiore Nyack Hospital, and it's also a certified home health agency that's been in existence since 1979. We offer skilled services of nursing, physical therapy, occupational therapy, speech therapy, medical social work, and aids. We are very fortunate in our home care agency to have the full-time services of a wound ostomy certified nurse. We treat about 300 patients a day. Not everybody gets a visit every day, but that's the census that we have in our home care department. We provide our services in Rockland County, and we accept referrals from hospitals, skilled nursing facilities, rehab facilities, and also from community physicians. Medicare patients that receive home care services must be homebound. And let me see what else I could say. Montefiore Nyack Home Care Agency is a 4-star quality agency with a 5-star patient satisfaction rating as rated by the Centers for Medicare and Medicaid.
And well, I'm overwhelmed by all this information already, so much that you do. You mentioned a couple of therapies, you mentioned a lot of things. So I don't even know where to start with my questions anymore. Like, let me ask you something. How did you get into home care? I mean, I have an idea how you get to be a doctor and a nurse. And is home care some type of a specialty or something like that? Like how?
So when you go into a hospital or rehab center or skilled nursing facility, all of those types of facilities want to make sure that when you have completed your time with them, that they have a safe discharge plan for you. And so oftentimes the people in those facilities, the physical therapists, the occupational therapists, the nurses, the physicians in those facilities do their assessments and say, okay, you've done everything you can in this facility, but now we think, you're ready to go home, but you may need a little extra help once you get home. Also, being able to function within the four walls of a facility is sometimes a little easier than it will be once you get home and there's uneven surfaces and stairs all over the place, maybe, or stairs to get into your home. And I mean, of course, then there's the winter weather, and there's all kinds of reasons why home is harder sometimes. And so they will make a referral to a home care agency, and we send out a nurse. Generally, it's a nurse, although it could be a physical therapist or a speech therapist, who goes out for the first visit and assesses a lot of things. It will assess whether a patient is homebound, and that's sometimes, for the Medicare patients, one of the hardest questions to answer. What does homebound mean? Homebound means that you have a usually temporary inability to exit your home frequently, easily, and for long periods of time. So Medicare, the CMS conditions of participation describe you needing a taxing effort to leave your home. You need the assistance of a device or the assistance of another person. That doesn't mean you can never leave your home. You certainly are encouraged to, go to your physician, go to any kind of, for tests that you might need. Even some personal errands like going to a bank or having an infrequent hairdresser appointment can be included in the homebound description. But if you're going out all the time, then you're probably no longer homebound. But we don't leave that up to the facilities to decide. Our nurses are very thoroughly trained in making the assessment if a person is homebound. So like a facility doesn't have to worry about that part. We'll do that part. If your community physician sees you in his office and decides that you need the help of any one of these specialties, like a nurse because you have a wound, or a physical, occupational, or speech therapist because you have some sort of an injury that requires you to have those therapies, they can make that referral directly to our intake department also. Very occasionally, we get caregivers or family members or patients themselves calling us directly. And while we can't open a case just based on a patient calling us and asking us for home care, we will initiate the communication with their physician to see if that person is appropriate for home care services.
Sounds interesting. So let's say that I have a patient in my family. I'm thinking a couple of things here. I guess a broken leg is not a good enough diagnosis for home care. Is it a little bit
yes,
more?
it might be.
It might be.
It definitely might be. Yeah, of course. Let me go over most of the highest diagnoses that we see at this point in time are patients with wounds, patients with musculoskeletal rehab needs, which is where the broken leg might fall into, patients with neurological rehabilitation needs, patients with cardiorespiratory diseases, diabetes, and heart disease. And so those are, there's many other reasons you might need home care, but those are the highest ones right now, the most, our most volume that we see.
So would it be safe to say that just if you're having difficulty leaving your home, you're eligible for home care?
No, you have to have a medical reason to need home care. There are other, and this might be where Kara might, help me out and talk about her services, because there are other ways of getting services in the community and possibly even in your home if your reasons for needing it are more social than medical.
Okay, so since you mentioned Kara, let's introduce Kara Stanley. So Kara, please tell us a little bit about you and what you do. And of course, your organization and how you come into this whole picture of patient care.
Thank you so much for inviting me, Sandra. It's a pleasure to be here to speak with all of you individuals. As Lorraine was sharing, we do deal with home care. We deal with it from a different aspect. So my name is, as you know, Kara Stanley, and I am the coordinator for the uh, Maternal Infant Community Health Collaborative um, program by the state, but it's called It's About You in the Community. And it's called It's About You because it's really all about the people that we serve. Um, Through the Lower Hudson Valley Perinatal Network, which is the organization that I work for, we have something that's called the Lower Hudson Valley Perinatal Network Maternal and Family Wellness Partnership, which is a long name, but we do a lot. How did I get into the work? um, I really liked, I really understood that I liked helping my community and serving them in any way possible. I used to do a lot of outreach work through my church and through other organizations and realized how I really like this. You know, they say if you would do something for free, then you know that's the place that you need to be. So an opportunity came for me to actually to work for this organization, but I had never worked in the birth work before. So this gave me the opportunity to see what that's like and be able to service those individuals for our standpoint who are either who have never had a child, who are currently pregnant, who are postpartum or into conception, meaning that they have had children, but they're not currently pregnant at the time. Lower Hudson Valley as an organization has been around for about 16 years. And the ultimate goal of the organization is to make sure that every baby is born healthy and wanted and is able to thrive in the community in which they are born. Okay, and how do we do that? We have our goal of the goal of doing that, or the strategy that we utilize is really to make sure that we support the families in any way that we can possible, knowing that if we're supporting the mom, there are other components in the household that we also need to service in order for the whole family to be well as, and that branches out into the community. Does that make sense? Good. So as I talk about the Lower Hudson Valley Perinatal Network Maternal and Family Wellness Partnership, I talk about it because it encompasses two home visiting programs. And what we do is one of them is called the Healthy Families Rockland, and the other one is called my program, which, like I said, shared, is called the It's About, we call it Mitch for short, for the Maternal Infant Community Health Collaborative. So we call that Mitch for short. So we say, Mitch, it's about you. So when you see our bright orange shirts with the logo that says it's about you, you'll know that it's us in the community. Okay. And what we actually do over the course of time is that we actually enroll moms who are in need of services. We do an assessment for them. And in the assessment process, we then realize what are some of the needs that they have. And then we try and address those needs. Um, Depending on which program they're in, they would either be in a program for 4 years or they'll be in a program for 2 years. It really depends on what the needs of the mother is. Both programs are geared towards educating our babies and moms, educating our moms to help with the health of the babies and the development of the child, as well as the development of the mothers or the care of the mothers. It gives the family coping strategies to deal with stressful parenting situations. We talk about health topics with the families through pregnancy, postpartum, and any part of life. And some of those health topics would be diabetes, preeclampsia, nutrition, exercise, a whole host of things to make sure that each family is really, for the next birth, that birth would become healthy. Okay. We look at understanding the child development. We also do like ages and stages, as well as the CDC child developmental learning. We do that so we can assess where the child is in their development. And if necessary, we try to get them into early intervention because we do a lot of referrals. But in order to do a referral, you need to know what the need is and why the referral needs to be made. So we can make the referral to the appropriate resource in the community. We also have something called the Breastfeeding Cafe under the Lower Hudson Valley Perinatal Network. And what the Breastfeeding Cafe is, it's there for moms who want to breastfeed, who have a thought, you know what, I'd like to breastfeed, but I'm not sure how that's going to work. Where it's there for them even if they don't want to breastfeed, but sometimes they just want to have adult conversations with some other mother who has experiencing the same thing. So it's a way of them going to, being able to fellowship or to have conversations with other people in the room. And it's run by a CLC, a certified lactation counselor, and it's overseen by an IBCLC as well. Okay. It's free of charge. We also encourage, and we make sure that we teach about positive parenting. We also do things by, like I said, connecting individuals to resources in the community. So how do we do the encouraging and helping parents have positive parenting? We do it through workshops, as well as we do it through one-on-one interactions with the families. And when I say workshops, we have a workshop coming up called Parenting Journey, which helps you to look back at how you were parented and look forward as to how you would like to parent your own child, right? That is an evidence-based workshop it's over a course of 12 weeks. And those who have gone through it, there are days when you're crying with the tissues, there's days when you're laughing, but those who have gone through it have said, it's been so impactful for them that their life is changing. And they said it's not like any other parenting class, because parenting classes sometimes just tells you what to do. This helps you to look inside and see, what is it that I would like to do? We also do other workshops such as financial literacy. So the parenting journey we have that's coming up, I believe it's on the 9th of March. Then we have the financial literacy that's coming up as well. And we looked at financial literacy because we realized that there's a connection between financial stress and low birth weight in babies. So we offer that as well. And that's coming up for us on the 4th of March. Then we also have another workshop called Stress Management. And that is specifically for our pregnant moms. Why? Because we realize as they're entering into a new phase, whether they've had children before, every child is different, or this is a first time pregnancy for them, there's a lot of stress that comes with that. So we do the workshop, which is also an evidence-based workshop. We give them tools that can help them to deal with the stress that's coming up. That workshop is starting on the 10th of March. We also have something called the Tutoring Service that we are just starting to help those children who are having some just because of COVID or whatever reason, they're having some issues with their lessons and they need some extra help. So we have that going on. We also talk about 39 weeks. 39 weeks is, why is it important for you to carry a baby to 39 weeks? Sometimes they have no idea and they make other decisions because they don't know. So the goal is honestly to really help our families to really make decisions working one-on-one with a community health worker. We also have something we do goal setting with them, because as you look at your own life and they look at their lives, children won't be children forever. So the goal is, how do we help them to set goals for themselves? And what does that look like in all of this? So these are some of the ways in which we really try and help our moms. We also do something called Baby Basics, which looks at each mom and helps them through each month of the pregnancy, where they're looking and they're asking questions and writing down their questions and help them to take it back to their provider. So how are we doing all of this? We're doing all of this with our community health workers or our family service workers, if it's the Healthy Families program. And we do it because with those two individuals, what they do is they work one-on-one relationship-wise with each family. Because as you build relationships, people will talk to you more. They may be afraid to talk to their provider, but they will talk to a community health worker or a family service worker. And that person makes home visits to the homes. Now, due to COVID, we can't do the home visits because we want to make sure the families, the babies, and everyone is safe and the workers are safe. So right now we're doing them virtually. But the role that they have is so impactful that some of them feel that community health worker is another member of their family. Can you imagine? You start out with just knowing somebody and that person becomes, you're like another member of my family. Or we've had families where the community health worker has helped to name a baby. Can you imagine that? Naming your child. This is crazy. But it just goes to show you that it's about building relationships and assessing the needs that each family has. We've found out that doing home visits is really, really important. Why? Because we realize that families sometimes they can't get out. There are things that they want to talk about. There are things that they need, and the home visitors will help them with that. What we've done due to COVID is now do drop-offs, because we also help with getting some of the essential needs, because we do referrals. If we do assessments in order to determine what they need. So we may determine that the family needs food. And if that is done, then we need to get food to them or help them to apply for WIC or SNAP or whatever it is, whatever resource it is. Or we might have to get them food from a pantry. We also do referrals if we've done an assessment and realize that they're suffering from domestic violence or they're suffering from some mental challenges or even mental stress. We quickly get them to the help that they need by doing referrals as well. But again, it's based on an assessment, and then we move from there by getting them into that resource that can really help them. And that's just, one or two referrals, that areas in which we make referrals for. We also help them with with SNAP or TANF or whatever it is that they have determined is a need for them. ESL, if they need ESL classes as they talk about their goals, we help them with that too. We help them with, just if they don't have health insurance, we get them connected to health insurance. If we also assess or check to see whether they're making these appointments. If they don't have prenatal care, we help them get to prenatal care. If they need transportation, a medical to get to their medical appointment, we try and assist them with that. That CHW or that family service worker is really like their second hand to really help them to really get what they need when they need it as much as we can do. Now, we're not miracle workers and we don't have wands to wave, but we really do try our best to work with the families to really help them to get where they need to be. And we work with them even when the babies are born, because even after babies are born, they're calling that the fourth trimester at this point. It doesn't go away. There are things that they still need, and you need to help them through the process. So does that make sense?
It makes a lot of sense. Now, this sounds terrific. It sounds like I need all of that. So the thing is, do I need to be pregnant? I guess so.
Not exactly, because
okay.
It really depends. So if you're in the Valley area, we have 2 community health workers in the It's About You program that will help someone who is preconception, which we call preconception, which is that they've never had any children at all, okay? And usually with those, we work with them to set some goals. And if they have some immediate needs like food or SNAP or WIC or health insurance, we try to get them connected with that. Because we also want to make sure that people are going to their yearly physicals, because that's important. Sometimes you may have insurance and you don't go, but then that helps. So we try to make sure that those that are in preconception stages, as well as the interconception stages, meaning that they have children, but they're not currently pregnant, that we're helping them through those things, the immediate needs, as well as making sure that they're attending their well woman's visit over the course of time and exercising and things like that, okay? Those that are pregnant, we work with them longer because we take them through the pregnancy stage and into the postpartum stage. So we hold them about 2 years. And if they're with if they come through the wellness partnership, then they have a choice of either the Healthy Families program or the It's About You program, which is my program. The Healthy Families hold them for 4 years. The It's About You program holds them for 2 years. And for Healthy Families, they can come in pregnant or up until when the child is 3 months old. But then after that, they would not be eligible for that program. And for the It's About You program, we can take them through all 4 of the life courses, which is having children, pregnant, postpartum, or they have children but are not currently pregnant.
So I have a shower of questions here for you, Kara. So one of the questions is, do you also offer adoption workshops or counseling?
So no, we do not. We do not offer adoption workshop, but what we do is we do have a partnership, because I thought that was important. Sometimes we have a partnership with some of with 3 adoption agencies. Here is why. Though it would be great if every baby that is born is wanted in the family, or it's a blessing to have this baby there, but we also know that there are certain situations where that's not the case. It may not be the right time or whatever the reason is. So we want to be able to give a person an option of for us to be able to connect them to an adoption service. So though we do not have a workshop, we have thought about that, and we do have connections with adoption services where we can connect them to them.
And what about Planned Parenthood or any type of family planning or something?
Absolutely. Good question, whoever asked.
It's not me, it's coming from our attendees. They're very smart people, you know?
I see, but I have the answer for you. So part of the work that we do with each family is that we talk about contraceptives, we talk about family planning, we talk about birth spacing, because we also sometimes we don't realize that if you have babies too close together, the body hasn't had an opportunity to heal as of yet. So we talk about those when we make referrals to Planned Parenthood or to their provider, and we also share with them things like FPBP, FPEP, and things like that, so we can. And we also deal with, well, it doesn't matter for us whether the person is documented or undocumented. None of the information is shared. We just want to help the people that are in our community. And for us, we service Spring Valley, which is 10977, and we service Haverstraw, which is 10927 as zip codes.
Okay, so you don't serve everybody, it's just those 2 zip codes?
Correct. Because of the nature of the grant, what was happening was we realized where the birth outcomes weren't the greatest, and the idea is where would we have the greatest impact. So we are fortunate because it's about, you can service both Spring Valley and Haverstraw. The Healthy Family services Spring Valley. And then we also do work for the It's About You program. We also service Westchester. And on the Westchester side, we're in Yonkers, Mount Vernon, and New Rochelle.
And you have to be a resident of those towns, correct?
Yes, and even those towns, we do have zip codes in which we service, again, for the same reason. But if we have every so often, we do have those that are outside. We don't necessarily turn them away. We can't enroll them into the program, but if there's something that we can quickly help them with, we try.
They're asking also, what about legal services?
So, okay, so again, it's about assessment of needs. So if we determine that you have a legal need, we try and find a resource that can assist with that and connect you with that. And we have some CHWs who are very passionate about making sure that they can connect their clients to legal services. What we found, though, is that there aren't a lot of legal services that will do pro bono work, which is what we're struggling with to find them, but we try. Okay.
Bilingual?
Yes. I'm telling you. So
you thought about everything. Okay.
HWs as well as our family service workers are bilingual. We have those that speak English, Spanish. We have those that speak English, Haitian, Creole.
Okay. Lorraine, back to you. Let's see if we can, show the world also what we're doing home care. So what about your geographic area of service? Is it also restricted? Do you have a little bit more, larger geographical area to serve?
We accept patients from anywhere in Rockland County. So all zip codes in Rockland County. If a patient resides here, it also does not necessarily have to be a permanent resident. So if someone from outside of Rockland County is staying with a daughter or a son, as long as they're residing at that moment in time in Rockland County, we can provide home care services for them. Our population is a little older than the population that Kara, speaks about. We are more in the 60, 70, 80 and beyond. Actually, our largest growing age group is 85 and over. That's more of the population that we're looking at. Although we will accept referrals for any age adult, we do not at this point have services for pediatric patients. We also make a lot of referrals. I enjoyed hearing Kara's talk on referrals, because that's the beauty of us having a full-time medical social worker that we can get to go out and see patients who have needs beyond their immediate medical crisis that we're out there for. They may just need more services ongoing once they're even feeling better. And so our social worker will go out and make community referrals and try to coordinate the types of services that a patient would need after they've been discharged from their acute medical illness or injury that we're in there for. We also, to also add on to what Kara was saying, we also have a certified interpretation service that we can use. It's called CIRICOM, and there's 150 languages. So, you know, we can really tap into that, you know, with the miracle of technology with speakerphones and things. It's a very HIPAA compliant service where there are certified interpreters that can be available within 15 seconds on the other side of the line. And, you know, basically are, you know, virtually in the room with you while you're speaking to the patient if you know, there is a language challenge.
You know, I haven't had one single session after COVID where we don't say the word COVID and we have a question about COVID. So here is the COVID question. For both of you, Lorraine, since I have your attention, I'm going to start with you. During these COVID times, how do you manage to go to people's homes and still make them feel safe? Like, what precautions do you take and all of that?
Okay, so back in the spring, there was a large population of people who became very afraid, you know, of having other people in their homes. But as we talked about, the people that we serve have a medical, you know, an acute medical need that needs to be addressed. And so that doesn't often lend itself to virtual visits, although there's a waiver right now allowing virtual visits. Our nurses, our physical therapists have found that it's much more effective to be able to visit patients in person. And so a lot of work was done to follow, we followed our infection control department's policies and procedures. So we get a lot of input from the infection control and prevention department at Montefiore Nyack Hospital, and they've helped us to craft the necessary supply of PPE or personal protective equipment that our staff wears whenever they go to see any patient, not just a COVID patient. There's more equipment that's used if we go to see a patient that is actively experiencing a COVID-19 diagnosis. But with all of our patients, we use actually the optimum amount of PPE in order to make sure that we are keeping our patients safe and our staff safe as they make these personal visits to patients' homes. What we found since the spring, and that initial level of fear, you know, I think that people needed to work through, is that most patients are not in any way timid about us visiting them. And so, you know, because we've taken all of these precautions.
Kara, what about you? How do you do your home visits in times of COVID?
So since the COVID started, we had to figure out what to do because our moms really wanted, they like being able to share their babies and be in the same room with their community health workers or their FSWs, family service workers. But we also had to consider the fact that they needed to stay safe. And with pregnant moms, it's not going to just affect them, it's going to affect their babies. So what we did was we went remote. And meaning that we'll do it via the phone, or we have something that that we use called .CME, which is kind of, it's like telehealth and it is HIPAA compliant. And then we have those moms who still, but we have items that we need to drop off. Okay, so what we've done is that we do these like doorstep drop-offs, and we'll go and we'll drop off the diapers and whatever items that we have for the moms, and we'll drop them off on the steps, make sure that we, of course, say hi. We may turn that into a home visit, especially during the summertime when it was warmer and you can be outside, because we are very, very concerned about how COVID would affect the family. Now, we do have all kinds of PPE equipment. We have shields, we have gloves, we have masks for them to wear, and we also have masks that we have shared with the families, just in case we get there and they don't have a mask, we could always give them one. But we're physically not in the homes as of right now because we really are concerned about our families. And since the population that we're serving is pregnant and postpartum, and as we know, the vaccine for them, it has not been tested on pregnant women. So we really have to be vigilant as to what we're doing as it relates to them. So, but yes, we're staying protected and we try to protect them as well.
So here, and here is the money question. It also comes up often. So how do you fund your programs? Because it's a lot that you are doing, both of you, Lorraine and Kara. So is it by insurance? Is it through grants? Let's talk about money.
Would you like to go first?
You can, Kara, go ahead.
So our program is grant funded through the state, and so the service provided to the community is free. All of the workshops that we do are free. We're doing them on Zoom because, again, it's a matter of keeping them safe. Even the Baby Cafe, that the workshop Baby Cafe is also being done virtual as well. It used to be done in the home, you know, in the office, like the WIC office, as well as MLK in Spring Valley, but now that's also being done virtually as well. Mm-hmm. But it is grant funded and they're all free.
And in home care, it is an insurance based system. Medicare and Medicaid, there is no fee for the patient. They're covered, you know, the services, if you meet the criteria, are covered completely by Medicare and Medicaid. Some of the private insurances, commercial insurances, and Medicare, also Medicare Advantage plans, in general, are also home care as a covered service with no patient responsibility. Some of the commercials and then the private insurances will have a copay. Patients will need to meet their deductible sometimes before, but we do have the service within the agency where before we even accept a case, we do research on that patient's coverage. And so when we go out to see the patient, we will inform them of what their copays are or what their deductibles are to the best that we've been able to determine that, so that they're fully aware of, you know, what these services might cost if they decide to, you know, engage with us in a therapeutic relationship.
I would like to add.
Go ahead, Kara.
So in talking about the Medicaid and the coverage for us, though 90% of our clients are low income and are Medicaid recipients, it doesn't exclude us from servicing all women that, you know, that may need the services. But our service, the ones that we have predominantly had are those that are low income in need of some of these services that we have.
Okay. Kara, since I have your attention, doula program.
So that's the one service that we actually don't have. We don't have a doula service. I'm telling you, I'm so for doulas that I wish we did. I was trying to find an organization that could fund us actually getting our CHWs trained as doulas, okay? But what we do is we, I have to say that at least one member of our staff, or two members of our staff are doula, are trained doulas. So it's nice for those moms who actually get those CHWs because they have a little of both. But for those others, we also make recommendations to Rockland Cafe on the Westchester side, because they have trained some doulas and they're called community doulas. So I believe they can get the service through there, but it's not a service that we offer, unfortunately, at this time. I'm still very hopeful though.
Lorraine, this is a question for you. You said that you serve the Rockland area, but you know, in Monty, Nyack, we see patients from Bergen County, New Jersey, Westchester, you know, other areas. So in that case, what do you recommend to these families to do if they need home care?
So if you access your health care outside of Rockland County, but you live in Rockland County, then you can choose our agency for home care services. If you're receiving your, say, inpatient facility services in Rockland County, but you live in Bergen County or Orange County, then the discharge planning team within the hospital will have a list of home care agencies in the county that you live in. And so they can provide you the names, and they will make the referrals to the agencies that are outside of Rockland County.
Perfect. So you don't just abandon them, you help them to establish some connections so that they keep receiving the services that they need. Excellent.
Yeah, definitely. And if they were, say, living with a daughter or son for a little while in Rockland, and then move back home, we will also facilitate the transfer of their care from within our agency to another agency in the county where they live.
Excellent, thank you. So at this point, I'm gonna invite Deborah Kagan Berkelind, I hope I said it right, to unmute because I know you wrote a long paragraph here. So I know you have a question for Lorraine about the Alzheimer's Association. So feel free, Deborah, to join us and ask your question to Lorraine. Go
Sure.
ahead.
Hi, everybody. Thank you so much for inviting me to this. This has been very informative. So I'm a care consultant with the Alzheimer's Association Hudson Valley chapter, and I'm with the Rockland area as the care consultant. And I was hoping that, Lorraine, perhaps there would be a way that I could connect with your social work staff and possibly your other staff to let them know about our services. They're all free. Prior to COVID, the pandemic, we could make home visits to do what we call care consultations, to meet with the families, to connect them to services and provide them with information and support around dealing with a loved one with Alzheimer's disease or related dementias. We had in-person caregiver support groups and education programs. We still do everything I just said, but currently it's all virtual over Zoom platforms or the phone. And the services are all free. And I just thought with your population, I'm sure a majority of your home care recipients, and which, by the way, I might add that my parents in the past have been recipients of NIAC home care and had been treated very well, thank you, that you probably do encounter patients who have Alzheimer's disease or their caregivers. So I just was wondering if we could connect so I could provide more information.
I would be very excited to connect with you around that, and perhaps set up an in-service. We're getting very good at the Zoom thing.
We are too.
So we can do in-services now with our staff. I will, if you let Sandra maybe know your contact information. She can either forward it to me or she can send you my information, either way, however you want to work that. And I will definitely hook you up with our wonderful social worker, Anna McManus, and our education coordinator, Noemi Martinez. And we would, I'm sure that we would absolutely love to set up an in-service.
Great. We would love to do that. Thank you.
Thank you.
That would be great. Thanks.
And thank you, Deborah, for participating and for your questions and all of that. See, we still have a lot to learn of all the resources that we have in the community. You could be a speaker next time, so we'll definitely connect.
I would love to do that. We love doing that. We're always trying to get the word out, so that would be great. Thank you. And thank you for holding these. This is a great way to learn about our community services. Thank you.
Perfect. And now we have another long paragraph from Dina Neyman. So if you wanna join us as well and unmute and talk to us, please go ahead.
Hi guys. Hi everyone.
Hello.
Hello. I wasn't expecting that. Hey, I'll take it.
Sorry, I didn't mean to put you on the spot. It's just that, by the time that I read all of that, it's good that we interact this way and we get to know each other.
That's great. I'm always ready to talk about VCS. My name's Dina Nyman. I am the coordinator of the Older Adults Counseling Program here at VCS. And what we offer, our contract with the Office of the Aging allows us to offer free counseling to anybody who is 60 and over. So they don't have to worry about paying, it's all free. We also offer some support groups We offer a COVID support group on Wednesdays at from 12 to 1 for anybody 16 over. Before that, I offer another caregiver support group from 11 to 12 on Wednesdays. A caregiver support group on Mondays from 10 to 11, and one on Zoom from 4 to 5 on Monday nights. So we offer a wide variety of caregiver support groups, counseling for those who are 60 and over. And, if anybody wants more information, please, give it. And in addition to our general counseling program and our mental health clinic, VCS offers a great variety of counseling services for those in need.
Definitely love to have your contact information also.
Absolutely. I put it in the chat box.
Okay, great.
So give me a call and we'll talk, or Zoom as I am doing these days. And just so you guys know, a lot of our caregiver support group has been hybrid. Some people are coming in and some people are on Zoom. A lot of our counseling has been telehealth.
Dina, do you have anything for children younger than 12?
We have a FINS program,
Mm-hmm.
which is in the schools, and Kathy Carty is the coordinator of that program. It's called FINS, Families in Need of Support, who need some support in school advocacy. We have a school advocate. We have a school advocate, Beth Keeperman, who is wonderful. She will help parents go through the process of getting their kids the help that they need and deserve, as far as knowing the system and fighting for IEPs and special help for kids.
I'm thrilled to hear all of you. I mean, we just started with Lorraine and Karen. Look how much we're finding. So, feel free. You all have my email. So if you just want to send me a quick blurb, I'm happy to put like a flyer together or something that I can email to all of you. And that way we can, share contacts and emails and all of that, and start creating this community that is going to make Rockland stronger, which is the purpose of this program. So Lorraine, I think I had a few more. Oh yes, I remember now. I have 2 more questions for you and we're running out of time. I feel like we need a part B to this. But Lorraine, there is something called plan of care or something like that. So please talk to us about that, because I think that's very important and we shouldn't leave today with that question.
I'm going to leave, but thank you. This is wonderful.
Nice to meet you, Dina.
Nice to meet you guys. We'll be in touch.
So the goal of a certified home healthcare program is to provide interventions, education, community referrals, and coordination of services so that patients can get better, reach their optimal, healthy and safe functioning in their homes, and then, hopefully in the community. And we do that by developing a plan of care. And it is always in conjunction and with oversight from the patient's primary physician or their specialist. Our nurse or our therapist performs an assessment that generally takes about 2 hours. It's a very comprehensive assessment. It's documented very specifically on tools that, that are mostly driven by, say, CMS's regulations. And it's used to determine what services are going to benefit the patient's medical needs. That plan of care is always approved by the physician. Any changes to it, any changes to the patient's condition are communicated to the physician, and he approves the changes, or he or she, I should say, approves the changes. And it's carried out over about a 6 to 8 week period of time. Some patients do stay with us longer if they have ongoing chronic needs that meet the regulations for home care services. And some are discharged more quickly. But I think it's important for the community to know that a home care service generally lasts somewhere within that 4 to 6 week period, with some being a little longer, some being a little shorter.
And when you're offering these services, is the same nurse or the same therapist going to the home every time, like kind of, to create that relationship with the patient, or it could be different nurses, different therapists? How does that work?
We strive for continuity of care. We do, but I mean, as you know, nobody works 24/7, 365. So because we see patients 2 to 3 times a week, if somebody has a day off, or, you know, a part-time nurse or therapist has been seeing that person, but they need to be seen when the other person isn't there, they will sometimes have a different nurse or therapist see them. But again, the optimum way is to have the same therapist and as many of the same nurses see the patient on a regular basis, so that that relationship can develop. Like Kara was talking about, you know, that not sure that we've named any children, but you know, I get letters all the time. We get letters from our patients all the time with just the most heartfelt gratitude, and the mentioning of, you know, specific therapists, specific nurses, specific home health aides, and our social worker saying that, you know, they changed their lives. So it is gratifying. It's a gratifying place to be.
Great, excellent, Lorraine. Now we only have a few minutes left. So Lorraine, if you have any final thoughts that you would like to share about your program or anything in general, and same thing for you, Kara, you can go after Lorraine. And then after that, we're just gonna close with a few, you know, items that I have and announcements, but please go ahead.
Well, thank you. I just want to thank you for this opportunity to, you know, to talk about our program and to talk about the people who work with me. The team is amazing. I can't say, there's no words to say enough about the team that works with me. So if you feel like you need home care, please, 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 you know, feel free to call in or to email me, or you know, to contact our agency, and we can answer your questions. Our intake department is always willing to interact with people around questions about home care. So, you know, I would just invite anybody who would like to please do that. And I thank you sincerely, Cassandra, for allowing us the opportunity to, you know, to tell us about to tell you about our services. Thank you.
Thank you, Lorraine, for making the time to join us and let us know more about this great program. Kara, your final thoughts?
So I wanted to also take the time to say thank you for giving us, you know, giving me the platform to actually share what our program does and the people that we serve. We really love our community, and the community health workers and the family service workers really go above and beyond for the families in which they service, which helps to really bring our communities to where they would like to be. I didn't mention about our PrEP team, which is our DREAM project, which stands for Dare to Reach Your Expectations and More, which deals with our middle schoolers and helps them to focus on their goals versus engaging in premarital sex, and, you know, and helping them to stay abstinent if possible. That's done through the school system. I also wanted to share, if I can send to you, Sandra, the flyers for the various upcoming workshops, so that people can, you know, register for them. It would be great. As well as we have a referral form for the Lower Hudson Valley Perinatal, Maternal, and Family Wellness Partnership, where you can fill out the referral and send it in. And that's when someone will contact you and share with you the 2 home visiting programs. And you can choose which one fits your family, you know, fits that family's best. As well as I wanted to share with you the flyer Breastfeeding Cafe in Rockland. Okay.
Perfect. So we're out of time. So yes, I'm going to wait for all of you to send me as much information as you have, and I'll be happy to, you know, redistribute among all of our attendees today. And, you know, lots of people in the community who I know need the service. Time is up, but I will see you next week, 12 p.m. We're going to be having a fun topic next week. Let me check real quick. It's fruits. What's the buzz? Because we always hear about the fruits and the antioxidants and all of this, and why are they identified as superfoods? Then the following week, we're going to be talking about rotator cuff injury, and on March 18, pros and cons of being a vegetarian. So again, lots of programming here. See you next week, 12 p.m. Thank you, everybody. Bye-bye.
Thank you. Bye.
Great to see everyone. Thank you. Have
Nice
a
to meet you.
nice to meet you as well.